Good afternoon, everyone, and welcome to the 2018 CAQH Index webinar. My name is Kate Meyer, and I'm the Communications Manager for CAQH. I will be moderating today's webinar. Before we get started, I would like to review some housekeeping details. Today's session is being recorded. The recording will be posted on the CAQH website tomorrow, and the link will be sent out via email to all participants. Please feel free to share the link with your network. Your phones will be muted throughout the webinar today, and all questions should be submitted online. You may ask your question at any time throughout the session. Simply type your question into the right side of the GoToWebinar panel, and we will address your questions at the end of today's presentation. The 2018 CAQH Index is now available for download on the CAQH website. We are also live tweeting this webinar and encourage you to join the conversation on social media. Today, we will start with an overview of the 2018 CAQH Index. We will then dive in and discuss the high-level findings and the savings opportunities. We will also go over how you can get involved in the index in the future. And finally, we will take all of your questions at the end of the presentation. Now, I'd like to introduce today's speakers. They are April Todd, Senior Vice President of CAQH Core and Explorations, and Christine Bernaska, Director of Research and Measurement here at CAQH. I will now turn the presentation over to April Todd.
Good afternoon, and welcome to the 2018 CAQH Index Overview webinar. Before we get started reviewing the results from the 2018 CAQH Index, I want to provide a brief overview of the purpose and content of the index. The index is a national survey in its 6th year, and it tracks the transition of manual to electronic administrative transactions between healthcare providers and health plans. The survey measures adoption of electronic transactions and the cost and time associated with manual and electronic transactions. Before we get started, I also want to thank those that have participated in the across the industry in submitting information and insights for the index. I also want to thank our Index Advisory Council for their guidance and expertise. As we work to provide the industry with insight to support the transition to electronic administrative transactions, the participation of the industry and our multi-stakeholder advisory council has been invaluable in helping us with this effort. So the index tracks the exchange of information along the administrative workflow between healthcare providers and health plans. And it starts from when a patient visit is scheduled all the way through when a provider is paid for those services from the health plan. So it includes transactions such as eligibility and benefit verification, prior authorization, claim submissions, claim status inquiry, and the payment to providers, as well as the detailed information called remittance advice that goes along with those payments. Before we start to dig into the detailed findings, let's review some definitions used throughout the report. So first, when we talk about transaction costs, we're talking about the cost and savings estimates that are only related to the labor required to conduct the transaction. When we measure this information, we are not measuring systems costs, and we are not measuring some of the pre-work and the follow-up work that are done at a provider and a health plan, both before and after submitting the transaction. We also, throughout the report, classify transactions into 3 different categories: electronic, manual, and partially electronic. Electronic transactions are those automated transactions conducting using a HIPAA standard. Manual transactions are those transactions that require end-to-end human interaction, such as through a telephone, through a fax, and or sending information through the mail. Lastly, partially electronic transactions include the transmission of information electronically, but not through a HIPAA standard. This includes transactions that flow through health plan web portals, for example, or IVR systems. So what did we find? So the key findings from the 2018 CAQH Index include the following 4 topics at a high level. First, we saw that the adoption of electronic transactions continued to improve for most transactions. As you'll hear from Christine later, there are some transactions that have definitely improved, while there are some others where there's still room for improvement. The dental industry in particular experienced some progress over the last year, but there are areas where it continues to significantly trail the medical industry, and we'll review that in depth as well. One key finding is that the volume of transactions increased substantially overall, particularly over the past few years. with manual transactions declining as we've seen overall transactions increasing. We also, for the first time in CAQH index history, have observed a savings opportunity decline, and this is directly related to the improvement we're seeing in adoption of electronic transactions. So now I'll hand it over to Christine, who will review the detailed results from the index.
Great, thank you, April. Hi, everyone. Thanks again for joining the webinar. Before we jump into the findings, I wanted to talk a bit about the sample. We continue to have a large representative sample of health plans. Medical plans represent almost 50% of U.S. covered lives, and dental plans represent almost 45% of the covered dental population. In terms of the provider data collection effort, we continue to work with NORC at the University of Chicago, which collects data on a variety of providers that are from a range of specialties. Next few slides, we're going to present the high-level findings related to adoption, volume, and savings opportunity. So looking at the medical industry, we see that adoption increased for all transactions with the exception of remittance advice, which saw an 8% decrease in adoption. Conversely, portal use for this transaction increased by 7%, and this is the only transaction to see an increase in portal use. Despite rising PA adoption, prior auth still remains the lowest transaction related to other in terms of adoption. It's noteworthy to note that 3 of the transactions are now at 80 or above. So you'll see that eligibility and benefit, claim submission, and coordination of benefits are at that level. We're going to now dig a little bit deeper into remittance advice. So we saw that the overall volume increased by 39%, and on a per member basis, volume also increased from 4 to 7.5, so that nearly doubled. The rise in volume may be due to duplicate postings. So we had heard from plans and providers that in some cases, there's duplicative postings not only on the electronic side of things, but also on a portal just to make sure the information is covered. So this rise in volume may be impacting the adoption for this transaction. It's interesting to look at the adoption for a prior authorization. So as I mentioned earlier, we saw an increase in adoption, but yet it was still relatively low. So while a national standard exists for prior auth adoption, this transaction continues to trail other transactions that also have standards associated with them. We saw manual increase 16 percentage points from this year to last and is now over 51%. So thinking about why we may have low adoption and high manual for this, we came up with a few potential reasons. The first being that there's a lack of vendor support for this transaction. In last year's report, we saw that only 12% of vendors support this transaction. Additionally, there's a lack of attachment standard. Attachment standard is used to support the transaction. There's also a lack of consistency among plan requirements for this transaction. And lastly, we may be seeing a rise in manual use because state mandates, in some cases, require a manual process for this transaction to be completed. Moving on to the dental industry, we saw that adoption increased for all the transactions with the exception of eligibility and benefit and claim status. And for both of these transactions, we saw an 8% drop in adoption. We also saw for these that manual use increased. So for eligibility and benefit, manual use increased by 8%, and for claim status inquiry, manual use increased by 18%. In both cases, there was also an increase in volume for these transactions. So eligibility and benefit saw volume increase by 40%, and for claim status inquiry, volume increased over 100%. So when we're thinking about adoption for these two transactions, it's interesting to note the volume as well as manual use. So looking at overall volume, we see that the volume increased for all but manual medical transactions, which we saw a drop. You'll see that the electronic transactions on the medical side increased by about 18%. On the dental side, you'll see that volume increased for both manual and electronic transactions by over 15%. As April had indicated, this was the first year that we saw an increase in savings opportunity, which was exciting news for us. So overall, we saw the industry savings drop from 13.1 to 12.4 billion, which was a 5% decrease. And as you'll see, the savings is driven predominantly by the medical industry, as dental industry saw a slight uptick in their savings opportunity. So interesting, we looked at volume and saving opportunities over time. And in the past, we've seen that as volume increased, so did the potential savings opportunity. But this is not the case this year. This year, we saw an 18% increase in volume, while we saw a 12% decrease in potential savings opportunities. And as April alluded to, this is due to the fact that the industry seems to be becoming more efficient as time goes on in regards to completing transactions. Now we're going to dig a bit deeper into the savings opportunity. And by doing this, it will help us understand what transactions and sectors are actually driving the savings opportunity so that we can focus on them as we move forward from an industry perspective as well as for providers and plans. So on a per transaction basis, the biggest savings opportunity is for claim status, followed by prior auth and eligibility and benefit. And you'll see that we've circled those in the right-hand column of the table. Each of these transactions has a high manual cost. So if you go and look in the various columns, you'll see, for example, that manual provider cost for prior auth is 10.11, as well as for claim status inquiry, it's $11.15. Interestingly, on average, a manual transaction costs the industry $4.55 more than electronic transactions. And so for all the three transactions that we just mentioned, this gap is much bigger. Looking at all of the transactions, we see that industry can save as much as $27.31 if all the transactions were conducted electronically as opposed to manually. And you'll see that is $14.64 for providers and $12.67 for plans. Projecting to national savings, eligibility and benefit has the highest cost savings opportunity at $4 billion. This savings represents 41% of the overall industry savings of $9.8 billion and is the largest saving opportunities for both plans and providers. Claim status has the second largest savings opportunity at $2.6 billion, which represents 27% of the overall savings. And remittance advice at $2.4 billion represents 25% of the overall industry savings. Also interesting to note that when you look at the savings opportunities for plans and providers, the provider savings opportunity is 6 times greater than that of plans. So something to think about as we continue to move forward. Digging deeper into eligibility and benefit, we see that the overall volume rose by 32%. This volume now exceeds the volumes of all other transactions. We've been told that the increase in volume may be due to the number and complexity of plans. The increase in volume is impacting costs, and as we move forward, it'll be interesting to see as plans increase and the complexity of the plans and payment models increase, how cost is being impacted as well as volume. Conversely, we saw a decrease in volume for claim status. So claim status, the volume declined by 20%. The high costs associated with this transaction may be associated with the lack of acknowledgments and corrections associated with payments, which result in more efforts to complete an inquiry, thus cost more. The drop in volume, though, may be due to value-based payments being processed separately from claims. So for both transactions, it'll be interesting to watch the adoption volume and savings opportunity over time. Turning to the time savings opportunities, we see the greatest savings opportunity for claim status, followed by prior authorization and eligibility and benefit. On average, providers indicate it takes 14 minutes more to complete a manual claims status inquiry compared to 5 minutes electronically. Interestingly, we found that on average, manual transactions require 5 minutes more to complete than electronic transactions. If we look across all the transactions, we'll see that providers could save, on average, 30 minutes if they completed all these transactions electronically as opposed to manually. Now, turn the presentation back over to April.
So we want to talk a little bit about how the industry can get involved. In general, there are 2 ways that the industry can get involved in supporting the transition from manual to electronic transactions. And we'll separate those into two buckets. One is a set of recommendations that we see from the index for the industry to make progress from the transition from manual to electronic transactions. And the second area is how the industry can help to get involved and help provide more insight into what's happening into the industry so that we have more information to base efforts to make improvements within the industry. So first, in terms of our call to action, ways that the industry can get involved is to focus on the key opportunities that were found within the report. The first would be to target those transactions with the greatest potential for savings. So as you saw from the results that Christine presented, there are definitely areas for savings opportunity around eligibility and benefit, around claim status, for example, in those transaction areas. Secondly, is to promote adoption by healthcare providers and the dental industry. As we've seen throughout the report, where the greatest opportunity for savings exists is with healthcare providers and providing support for those providers to be able to submit information electronically. We've also seen that within the dental industry, there is a significant lag in adoption of electronic transactions, and there are a variety of reasons for this that we have heard from the industry and reported in the report. One of those being the lack of vendor systems that can support that information, the transmission of information for the dental industry. So there's definitely a need here to focus both on healthcare providers and the dental industry more broadly. The third area in terms of focus for the industry is to work to accelerate updates to standards and operating rules to help support the evolving needs of the industry. As we've seen throughout the results of the report, we see for different transactions patterns that show there is a need for an adaptation of the standards to address new and emerging needs. We see this in the increasing volume related to eligibility and benefit transactions. We see this in the duplication of information that is submitted both in portals and through electronic transactions for remittance advice. We see this across the industry related to use of clinical information, whether that is through prior authorization or to support claim submissions from providers to plans. In many instances, we see that what is occurring here is really a transition from volume to value, where the industry is moving towards value-based payment. As we move in that direction, there will be a need to adapt our transactions to be able to process that information so that there's not a need to communicate that information through portals or separate electronic devices or manually through the phone, fax, or mail. Fourth, another area for opportunity is to encourage timely vendor adoption of standards and operating rules. And this is where we see, as I mentioned before, the biggest need is within the dental industry to help support that. But there are also pockets as well throughout the medical industry, for example, related to prior authorization and to attachments, where there's opportunity as well. In the second area, in terms of how we can improve the information that we have about what's occurring in the industry, there are ways that the industry can help support that as well. One is through helping to enhance the understanding of administrative operations and to help to do this through the index. We can help increase and diversify the sample through a broader stakeholder collaboration. We can also work to expand the content of the index. As we mentioned before, we are, through the index, looking specifically at the transaction itself, not necessarily what occurs before and after a transaction within a workflow. There's important information there that can be gleaned that can also help to understand what is occurring within the industry. And then lastly, there are opportunities to streamline data collection mechanisms and to make it easier, particularly for providers, to submit information and for us to glean insight from what is happening within the industry. So in terms of the second bucket of how people can help support this additional effort with the CAQH Index, Christine, can you provide some more detail on how those in the industry can start to participate in the index?
Sure, thanks, April. So in closing, I would like to ask that you participate in the 2019 Index as either as a data contributor or index supporter, promoting participation in the value of the index. So through word of mouth, we've actually been able to increase our sample size, not only at the provider level, but also at the plan level. And we'd like to continue to see that word of mouth activity increase. We're working with not only our advisory council to increase the sample size, but also with other organizations within the industry. It's important to note that all participants receive a benchmark report, which allows them to compare themselves to the industry on key metrics. And through interviews and speaking with people, we've been told that this report is very useful for future planning and strategic decision making. And many times people have said that they've brought the report, the benchmark report, into meetings with the executive team or senior management to discuss not only how they're doing relative to others, but where they can focus and target their efforts in the new year related to the adoption of transactions, knowing that moving from manual transactions to electronic transactions can not only save costs, but also time.
Great. Thank you, Christine and April. Now we would like to answer your questions. Again, please submit your questions by entering them into the question section of the panel on the right side of your screen.
Okay, so it looks like we have a few questions coming in here. We wanted to make sure we provided a lot of time. Last year, there were a lot of questions that came in during this webinar, so we wanted to make sure we provided a lot of time for people to ask questions. So one of the questions that we are getting in is a question about some more information on what may be driving the increase in eligibility and benefit volume. So it's a great question, and it's particularly interesting because it is the transaction where we saw the greatest increase in volume. It is also the transaction that is seeing the greatest opportunity for savings as well. So in terms of providing more detail around the eligibility and benefit transaction, what we are seeing here in terms of the volume and the savings opportunity is really around complexity. What we have heard in the interviews from a provider's perspective as well as from the plan perspective as well is that the variability, the volume, and the complexity of health plans has been increasing. And the information that providers are looking for, whether that is updated information on cost sharing and deductibles, or whether a patient is eligible for care, the details of the benefit plans, there's definitely more interest there from providers as the plans have become more complex. So we are hearing from providers that they are, throughout a patient's cycle, through the workflow, that they are submitting those eligibility transactions multiple times. From a manual perspective, we're also seeing increases in cost as well, as there are components that are not included in the transaction where a provider needs information, for example, related to a value-based plan or a bundled payment or a service that really isn't communicated within the transaction that is requiring a phone call or additional information that the provider needs. So really the answer is complexity. That's the reason we are seeing this increase both in volume as well as the cost savings opportunity for this transaction.
Great. We also received a question asking if we provide vision data or collect vision data, and we do not. So currently we report at an aggregate provider level as well as at the medical and dental level.
One additional question that is coming in is how can providers participate? Christine, you want to take that one and how we engage with providers and how we work with NORC?
Sure. On the provider side, what we do is we have a sample of individuals that we've reached out to in the past. The list includes providers that were not only sent to us, but also are from a list that was provided to NORC. If you agree to participate, we will send you a tool, which is now an electronic tool to collect the information related to adoption, volume, and savings. And NORC, we have NORC on the phone. Angela, I don't know if you'd like to add anything else. I know that for next year, we're going to try to begin data collection earlier so that individuals can have more time to provide us with the data, as well as we're thinking about how we can make the data collection tools more efficient and easier to use.
Yeah, so we're trying to move to an electronic tool next year to make the data collection process a bit smoother. The tool includes asking about transaction volumes and time it takes per transaction. And we do have, as Christine said, we do have a list that we've compiled over the years with CAQH contacts. We purchased a hospital administrator list as well as past webinar participants or those that other NORC contacts that we know. And so, is there any other questions that I can answer?
Thanks, Kristen. That's very helpful.
So another question that came in is, when it comes to checking claim status, are transactions checking prior authorization status included in that number?
So with regard to claim status, information related to a prior authorization or checking for a prior authorization would not be included in that transaction. It would be included within the transaction for prior authorization.
We also received a question about the benchmark reports and when people could expect to receive them. Once the report is published, individuals who participate can expect to receive a benchmark report within 2 to 3 weeks after the release of the report.
There's another question here regarding whether the report provides a list of states requiring manual process for prior authorization. The report does not provide a list of all of these requirements. We do highlight a few states that do have requirements related to prior authorization, but the report does not have a comprehensive list.
There are some housekeeping questions that came in regards to when the presentation and webinar will be made available. They will be made available within 24 hours of the webinar. You can also find the report and the press release on the CAQH website if you're interested in that as well.
We have a question coming in regarding the difference between a fully electronic and a partially electronic categorization. The question is, are transactions that are fully electronic but not submitted in the HIPAA standard considered in this data? And if so, how would they be categorized? So they would be captured within the data. We ask our participants, both on the provider and the plan side, to categorize for us how information is submitted through the HIPAA standard or through some other mechanism, so it is captured. If it is not submitted through the required HIPAA format, it is classified as a partially electronic transaction. So, for example, a homegrown system or a web portal that uses its own requirements would be classified as a partially electronic transaction.
We had a question about remittance advice and the adoption portal adoption. And so we discussed that the adoption for remittance advice dropped by 8%, and we saw that portal increase. We can also say that the manual use for this transaction remains fairly stable. And so for more information related to the remittance advice transaction, you can go to the report. But I know people were just there. We had a question related to the numbers related to fully electronic, partially electronic, and manual.
We also have quite a few questions coming in here related to prior authorization. So I'll go through a couple of those. One line of questioning here is whether there is a sense of where manual prior authorization transactions are primarily occurring. For example, is this for small providers at a hospital level? And really in the data collection that we have done, manual transactions are occurring across the industry. Given the low level of electronic adoption, that's at 12%, we are really seeing this across the industry in terms of use of manual mechanisms to inquire and submit information related to prior authorization. There's also another question here that asks about the prior authorization, the 278 transaction, and why so few vendors support it. So what we have heard in the survey that we conducted last year related to prior authorization and vendors is a few different things that are occurring there. One is that the industry in general has been waiting for the release of a standard related to attachments that can support clinical information being submitted with a prior authorization as well as with a claim attachment. And so there is some hesitancy related to, with most prior authorizations, the need to submit clinical information. So there is a concern there. There also is just a variability in what health plans are asking for related to prior authorization that has created a desire to have individual portals and the plans preferring those portals. That has also made it challenging for the vendors to address this space.
Received a question asking if we refer an organization to participate in future surveys that have not done so in the past, what is a recommended way for them to connect with you to participate? They can reach out to us at explorations@caqh.org. That information is also on the website where the index is located. We also have a question on, do you plan on adding or removing any transactions in the future? After each data collection, internally, along with our Index Advisory Council, we review the transaction as well as the findings and the data collection tool overall. As you can see, claim submission right now is at 96%. So we have discussed internally whether we want to sunset that transaction or if we continue to ask it every other year, seeing that it is very high right now and we've seen little movement around it. In terms of removing some of the other transactions that have low volume or that we're unable to report on, we also are discussing that. We have found that in some cases, plans do not collect information the way that we're asking for it in the tool, and or the information is disjointed within their organization. So it's not easy for them to provide us with volume or adoption rates for certain transactions. So knowing all of this, we will be looking at the tool as well as the transactions and gathering information. And we do plan on tweaking the tool some in the future to either add or delete some of the transactions.
We have a few questions coming in related to whether the data submissions can be sliced and diced in some different ways. One of them is related to whether the information can be broken out by state. To date, we have not broken that information out by state. It would be something that we would be interested in doing in the future. It's definitely something we could look at. We may need to look at the volume of information coming in and whether it would support all of the states. But to date, we currently are not providing information by state. There's another question in the same vein around whether information can be reported by specific health plan. And on that particular topic, for any data submitter that submits to the index, whether it's a plan, a provider, or a vendor, we do not release provider, vendor, or health plan specific information. It is de-identified in the index to encourage participation. We do, however, for those, as Christine mentioned earlier, for those that participate in the index, we do provide a benchmark report where they can see how they look compared to the rest of the industry.
Another question is, what is the best way to get involved to help change or add clarity or create best practice guidelines to help alleviate some of the challenges we face with handling transactions because of the disparity in the interpretation of the guidelines?
So in terms of providing detailed information or some insight as to why certain transactions are working or certain transactions are not working, this is exactly the type of insight that we engage with our plan, provider, and vendor participants that submit information. As we are looking at trends, we engage with those organizations to understand that. If there are individuals that have information and want to contribute and provide insight to us, would very much encourage you to become a participant of the index. We are definitely looking for this level of detailed insight to help advance progress.
And to follow up with that, we would like to, throughout the year, release reports related to information within the index, some of them related to best practices, some of them related to digging deeper and analyzing the data a little bit more. after we've reached out to individuals to obtain some more information. And so we definitely welcome anyone who wants to share information or best practices with us. Along that same vein, we received a question that says, what can be done to drive electronic adoption for dental? And I think that's a question that we were asked last year, and again, a question this year. We presented at NADP and have been in talks with ADA, and it is a frustration for them in terms of the low levels of adoption relative to the medical community. And so one of the things that we heard was that the lack of vendor support or systems which support transactions for the dental side is something that is frustrating to the dental community. So I think working and better understanding what vendors can do to help move from manual transactions over to portals and or electronic transactions would be helpful. We also have talked about using some of the best practices in the medical community to see if they can be applied to the dental industry. The dental industry, I know, would like to become more automated, and I think they're just struggling with the technology and the guidelines and the practices to which they should adopt.
We have another question that has come in around the ERA or the remittance advice transaction. The question is, with the ERA transactions declining due to the use of portals, does this mean that providers are obtaining their ERA files via payer portals? The answer is yes, likely. What we have heard in the interviews with our participants, particularly related to remittance advice, is that the increase in volume is related to, in many instances, the information being posted both through the transaction, the electronic transaction, as well as through a payer portal. And that we are seeing some duplication there with the intention there that it's provided in both mechanisms so that the payers have flexibility as to where they can get that information. We also have a question coming in, another question related to prior authorization. The question is, when it comes to prior authorization attachments, can vendors use 275 files or are those insufficient? So vendors can use the 275 transaction for communicating information, and we do know that there are some vendors and some providers and plans in particular that are using this transaction. It is small, but it can be used. We have heard there are some issues with the 275 in communicating some information, but the transaction has been useful for those that are using it based on the interviews we've.
We have a question around how much time does it take to participate in the index, which is a good question, and varies by whether you have participated in the past or not. For first-time individuals who come in, we've been told that it takes about 8 hours. This also assumes that you have the data available and you have the data in a format that can be translated to the tool. In some cases, as people dig into the tool, they found that it requires them to talk with other individuals to obtain the data, so that may require a little bit more time. We've heard, I think, a maximum of 16 hours, but knowing that the data collection period is very long, so that will be extended over at least a month, if not longer.
Okay. We have another question coming in related to one of the recommendations for accelerating the adoption of standards, and if there are efforts currently going on in the industry to do that. So there are efforts across the industry right now to work to accelerate both the adoption of standards as well as the updating of standards and the operating rules that support them. In particular, the National Committee on Vital and Health Statistics that reports up to HHS on recommendations for the industry has actually over the past year or so been working with the industry on recommendations for how standards and operating rules can be updated and accelerated within the industry. And actually within the month of December, held a hearing with all of those participants to discuss those recommendations and what could be improved within the industry. Within the report, we provide a link to that information, both the recommendations as well as a recording of the hearing. So that information we have provided within the report. There's another question in here asking for some examples on, particularly related to value-based payment, what types of things could be updated or improved in the transactions to help support value-based payment. So a couple of examples there, and maybe would focus on eligibility and benefit. So some areas where there could be some improvements in terms of the data that is transmitted between providers and plans. What we have heard is more detailed information about the benefit sets. For example, information around provider attribution. So which provider is a patient attributed to under a value-based payment arrangement. Those are some examples that we have heard that could be helpful in supporting value-based payment related to eligibility and benefit in particular. The other thing I'd add is this is also an area where CAQH core that puts together operating rules to support the standards is pulling together a expert advisory group this year to work on operating rules specifically that can support value-based payment and support the standards.
I think, April, as a follow-up to that, I think it's worth noting that in regards to the index and how the index can be used to collect data points related to value-based payment, we have been talking about enhancing the index tool to actually obtain more information related to certain tasks that are provided in a VBP model as opposed to a fee-for-service model, with the thought that we could start identifying maybe some pain points related to VBP processes, as well as any challenges that may exist. That is something that we've been discussing internally and hope to dig deeper into in the coming year.
We have another question coming in around regulatory support for transactions. The question is, are there any current efforts to support adoption of transactions through a regulatory mechanism? So in addition to the comment I made before around NCVHS, the other thing I would highlight is that currently HHS is working on an attachment related standard that would, once it comes out, could significantly help related to prior authorization and claims payment. And so that is an area that we anticipate would have some significant impact. This is also an area where CORE would be providing some assistance related to operating rules to help with the transmission of some of the data content of that information, as well as some response time requirements related to that standard.
I think it's worth pointing out, as April's been discussing some of these operating rules and what we have been doing internally as well as those in the industry. If you haven't already taken a look at the report, you will see that throughout the report, there's mention of some of the operating rules and some of the initiatives that are taking place, not only within CAQH, but also within the industry.
Another question coming in, this is similar to the vision question that came in earlier. The question is around pharmacy and whether the index tracks information on pharmacy, and if not, if there is a desire to do so in the future related to pharmacy. Currently today, the index does not capture information related to pharmacy transactions. It is something that we have been in discussion to potentially start doing in the next year or so. So it is definitely an area of interest, but it is not an area where the index is currently tracking information.
And it's worth noting that for some of these questions asking if it's pharmacy or vision or certain breakouts of the sample, as April mentioned, I'll just do another plug that we would love to be able to break out the data into different groups, different areas, etc. We just need larger sample in some cases. So again, just a push for participation in the index, or at least mentioning it to either others in the industry, your stakeholders, etc., to provide us with data that will only enrich our findings and our insights.
Okay, great. Thank you, April and Christine, and everyone for participating. This concludes our webinar. Thank you for joining us. If your question was not answered, we will follow up with you via email. As a reminder, the webinar recording will be up on the CAQH website tomorrow, and you will receive an email with a link of the recorded webinar. Thank you again. Have a great day.